సైన్ రాదన్నమాట. Hello, good morning all. Today our class is about in clinical microbiology respiratory tract infections. Mainly in respiratory tract infections there are two. One is upper respiratory tract infections, another one lower respiratory tract infections. In upper respiratory tract infection, it includes infectious airway passing through glottis or vocal cords. Means glottis or vocal cords, nasal cavity, pharynx, larynx. These three will be included. Nasal cavity, nose, sinuses, pharynx, larynx. These all comes under upper respiratory tract. Whereas in lower respiratory tract, trachea, bronchi, bronchioles, lungs. These will comes under lower respiratory tract. These all you will read in anatomy. Bronchopulmonary segments and bronchiole, alveoli. These all will come under lower respiratory tract. In upper respiratory tract, typical infections of upper respiratory tract includes itis. Itis means inflammation. Itis means inflammation. This is inflammation. In upper respiratory tract, tonsillitis, pharyngitis, laryngitis, sinusitis, otitis, and rhinitis. These all will come seen under upper respiratory tract. Inflammation in tonsillitis, pharyngitis, laryngitis, sinusitis, otitis media, and rhinitis. Symptoms. While these upper respiratory tract infections will be seen, symptoms of upper respiratory tract can include cough. Mainly cough will be seen. Sore throat. At the same time, sore throat also usually we will see. Running nose. Some people will continually running nose will be seen. Nasal congestion. Nasal congestion. When these all symptoms are there, then definitely in common cold also we will get headache, and low grade fever will be usually seen. Facial pressure and sneezing every time they will sneeze because continuously cold will be there, running nose. That's it. In lower respiratory tract infections, what we said already, trachea, bronchioles, lungs, these all will come under lower respiratory tract. It includes bronchitis, pneumonia, and lung abscess. Finally, we will see pneumonia. In pneumonia, two are there. It refers for two. Inflammation in lungs, which can lead and classified into two types. One is community acquired pneumonia, another one hospital acquired pneumonia. One is community acquired pneumonia and another one hospital acquired pneumonia. In community acquired pneumonia, there will be one called CURB, C-U-R-B, CURB. C for confusion. It gives 1 point. U for blood urea and nitrogen. It will be less than 19 milligrams per deciliter. 19 milligrams per deciliter. R is respiratory rate. Respiratory volumes lung volumes, lung capacities, everything you have read in physiology. Now, respiratory rate, less than 30 minutes. BP, scurb, B for blood pressure, 90/60, more than. It also gives 1 point. This curb, community acquired. Who will be immediately join in this hospital by doing this test curb? Less than 1 point, patient should be immediately admitted in hospital. Less than 1 point. If more than 1 point, the patient can be kept at home and treated. No need to admit in hospital. Correct. CURB. It will ask in 2 marks, or if multiple choice is there, bit also will come. Correct. Next, upper respiratory tract infections. Respiratory tract infections may occur in nasopharynx, oropharynx, middle ear, and paranasal air sinuses, epiglottis, larynx, trachea, bronchi, bronchioles, and lungs. I told already. These all are not only upper respiratory tract, whole respiratory tract infections there in this. In this lower respiratory tract, trachea, bronchi, bronchiole, and lungs. From this trachea onwards, lower respiratory tract. These all are upper respiratory tract. Total, these all are respiratory tract infections. Upper respiratory tract infections, pharyngitis and tonsillitis, and laryngitis. Pharyngitis. High grade fever usually seen, cervical lymphadenopathy, and exudates on tonsillar area. Clinical presentations. Diphtheria, pseudomembrane will be formed. False membrane will be formed in diphtheria cases. Corynebacterium diphtheria. Viral infections. If upper respiratory tract caused by viruses, cough and fever will be seen. Etiology of upper respiratory tract infections. Bacteria which the agents are causing upper respiratory tract infections are Streptococcus pyogenes. You will be reading systemic bacteriology, Streptococcus classification. In that, group B, Streptococci. These are pathogenic Streptococcus pyogenes. For this confirmation test, basic tracing drug. If you remember or not, you recollect once. Streptococcus pyogenes. Corynebacterium diphtheria. For this, which media you will use? Loeffler serum slope. For finding microscopical examination, we can do Albert stain. We can do Albert stain. In Albert stain 1, Albert stain 2, 2 stains will be there. Malate gain and toluidine blue will be there in that reagent. Mycoplasma pneumonia, Staphylococcus aureus. This one is first one. Staphylococcus aureus. It produces golden yellow pigment on nutrient agar and special media milk agar. Haemophilus influenza, Streptococcus pneumonia. It produces alpha hemolysis on blood agar. Streptococcus pyogenes, it produces beta hemolysis. Complete hemolysis will be seen for Streptococcus pyogenes. For Streptococcus pneumonia, alpha hemolysis, partial hemolysis will be seen on blood agar. For this, one spotter also will come. Alpha hemolysis and beta hemolysis. Group B Streptococci. Mycobacterium tuberculosis. TB. In TB patients also, light fever will become and cough. Predominant cough will be seen. Atypical mycobacteria. Pseudomonas aeruginosa. In burn patients, these will be seen. Pseudomonas aeruginosa. Pseudomonas pyocyanin, pyominin, pyorubin, pyovegin. 4 pigments it will produce. Out of this, pure Pseudomonas aeruginosa, it produces bluish green pigment on nutrient agar. Bordetella pepticis, Klebsiella species, Klebsiella pneumonia. It also causes respiratory tract infections. Neisseria meningitis. These are bacteria. Now, agents causing upper respiratory tract infections, virus. Viruses are commonly adenovirus, is space wheel shape, like Aditya 369 లో స్పేస్ వీల్ ఉంటుంది కదా అలా ఉంటుంది స్పైక్స్ అన్ని ఎడినోవైరస్ రైనోవైరస్ 2 మార్క్స్ లో కూడా అడగచ్చు నేమ్ సమ్ వైరసెస్ కాజింగ్ రెస్పిరేటరీ ట్రాక్ట్ ఇన్ఫెక్షన్స్ అని నేమ్ సమ్ బ్యాక్టీరియా కాజింగ్ రెస్పిరేటరీ ట్రాక్ట్ ఇన్ఫెక్షన్స్ అని అడుగుతారు అప్పుడు మీరు బ్యాక్టీరియా అడిగితే బ్యాక్టీరియా 4 వైరస్ అడిగితే వైరస్ 4 ఫంగల్ అడిగితే ఫంగల్ నేమ్ సమ్ అండ్ 2 మార్క్స్ లో రావచ్చు ఇదే ఎస్ఏ కింద రాదు వస్తే 2 మార్క్స్ లేకపోతే బ్యాడ్ లక్ 4 మార్క్స్ రెస్పిరేటరీ సిన్షిషియల్ వైరసెస్ పారా ఇన్ఫ్లుయెంజా వైరస్ ఎప్స్టీన్ బార్ వైరస్ పిబివి ఇకో వైరస్ మీజల్స్ వైరస్ పారాసిల్లా జోస్టర్ వైరస్ these all are caused upper respiratory tract infections viruses now fungi Candida albicans, budding yeast-like cells. Candida. As per for confirmation, Candida albicans, which test you can be performed? Reynolds broad phenomenon under germ tube test, chlamydiospores test for Candida albicans. Aspergillus species gram stain కూడా చేస్తే violet color shade yeast cells convert violet color yeast cells if gram stain we have done for Candida albicans in microscopical examination. Aspergillus species Cryptococcus neoformans Pigeon species one also it only fungal found in India. Cryptococcus neoformans Histoplasma capsulatum, Blastomycosis dermatitis, and Pneumocystis jirovecii. Parasites causing respiratory tract infections. Paragonymous westermani, Florianse sinens, Ascaris lumbricoides, roundworm, Ankylostoma duodenale, hookworm. 4 blastomates will be present in Ankylostoma duodenale. For this, segmented and unsegmented worm, atrophied worm, everything will be same. 2 layers will be there. Before going to this, oral cavity infections mainly. 1. Upper respiratory tract infections, viral infections, bacterial infections, and fungal infections. 3 will be seen. Viral infections may sample collection specimen is nasopharyngeal swab or throat swab or aspirates for viral infections. Further, cell cultures will be done. Cell cultures mainly adenovirus, Epstein-Barr virus, herpes simplex virus, influenza virus. These will be cell cultures. For bacterial infections, throat swab here there nasopharyngeal swab and throat swab and aspirates in viral infections. In bacterial infections we will collect throat swab and blood at the same time, blood for serological test serum. For throat swab microscope test will be done. for microscopic examination. Then we have done gram stain and Albert stain. For gram stain, staph, strepto, pneumo for this. Albert stain, especially for Corynebacterium diphtheria. For culture, for all routine bacteria can be grown in blood agar, nutrient agar, and McConkey agar. But Corynebacterium diphtheria can be grown in Loeffler's serum slope. From there, potassium tellate blood agar can be incubated in media for 6 to 8 hours, and then from Loeffler's serum slope, from then it can be inoculated into potassium tellate blood agar, and it can be kept for 48 hours for incubation, further incubation. Finally, antimicrobial sensitivity testing will be done. Antibiotic sensitivity testing. For bacterial infections, we will done these process for laboratory purpose. For viral infections, cell cultures. For fungal infections, for upper respiratory tract infections, throat swab can be collected and it can be cultured into saprose, dextrose, agar media. Saprose, dextrose, agar media. And it can be kept at 37 degrees centigrade for 24 hours. Now, for bacteria, already I have told this. Bacteria, 2 throat swabs. One is for microscopy and another for culture. Diphtheria, membrane, pseudomembrane. Viruses, nasopharyngeal swab, aspirate, or throat swabs. Already these I said. Serum, mainly for streptococcal pharyngitis or infectious mononucleus. Serum. Anti-streptolysin O for Streptococcus pyogenes, ASO, anti-streptolysin O for serum examination. Microscopy, I have already taught you. Gram stain, Albert stain, culture blood agar, potassium tellate agar for diphtheria, saprose dextrose agar for candida. Before going to this, oral cavity infections, mainly oral cavity, oral cavity infection, stomatitis. Stomatitis means inflammation in mucous membrane will be seen of oral cavity. Stomatitis. These all will be seen in dental department if you go for OP. Inflammation of mucous membrane of oral cavity. Most common herpes simplex virus. Painful vascular ulcers will be seen. Oral thrush, you have read this in mycology. Oral thrush, characterized by whitish patch of excluded in oral cavity. Mainly it causes candida albicans. Mainly it can be seen in immunocompromised patients. Immunocompression, immunocompromised patients. Next, periodontal infections. Periodontal infections means root canal infections, perimandibular infections will be seen. Mainly it causes Streptococcus sanguis, Staphylococcus aureus, and Echinella corridens. Echinella corridens. Streptococcus sanguis, Staphylococcus aureus, and Echinella corridens. Periodontal infections it causes. And at the same time, salivary gland infections. Salivary gland infections means parotids is mainly painful and tender swelling will be usually seen. Parotids is mainly painful and tender swelling will be usually seen in parotid glands, mainly causing the organisms Staphylococcus aureus, mumps. Mumps is viral agent. It is a viral agent. Staphylococcus aureus is a bacterial agent. Next, causative agents of common cold. While going to this, causative agents of common cold usually seen. Rhinoviruses, common cold will be seen. Coronaviruses, Coxsackie viruses, coronavirus now we are in that one. Coxsackie viruses, influenza viruses, para-influenza viruses, these all are common cold causative agents. Viruses, adenovirus and echoviruses. Sinusitis. Sinusitis means headache usually seen, thick nasal mucus secretion will be seen, and plugged nose. Plugged nose will be seen. Agents of chronic sinusitis, obligate enrobes and Staphylococcus aureus. Causative agents of sore throat. Sore throat is a bacteria, mainly Streptococcus pyogenes. Streptococcus group C and G. C group C ante Streptococcus equisimilis and throat commensals. G anedi species G anedi throat commensals. It is a commensal, but sometimes it causes tonsillitis and endocarditis. Corynebacterium diphtheriae. It also causes sore throat. Haemophilus influenza and Borrelia vincent. These are bacteria causing sore throat. Viruses. Virus causing sore throat are rhinoviruses, coronavirus, Coxsackie virus, influenza virus, para-influenza virus, and adenovirus. These all will cause sore throat. Epstein-Barr virus. This also causes sore throat. Fungus, Candida albicans. Mainly fungus, Candida albicans. It causes sore throat. For suspected bacterial upper respiratory tract infections, I already said this one. I covered now what agents, viruses will cause upper respiratory tract infections, common cold, sinusitis, sore throat, everything I told now. Now, finally, I am repeating. For suspected bacterial upper respiratory tract infections, one we will collect throat swab and membrane. For throat membrane, Corynebacterium diphtheriae, pseudomembrane will be found. Throat swab, all other jab. Serum. For serum, especially I told anti-streptolysin, Streptococcus pyogenes, ASO. Microscopic gram stain, Albert stain. For throat swabs, we have to collect two throat swabs. One is for microscopical examination, another for culture, microscopy, and then culture, and then done gram stain, Albert stain. Albert stain, especially a special stain used for Corynebacterium diphtheriae. For this culture, blood agar, culture into blood agar, McConkey agar, Loeffler's serum slope. Loeffler's serum slope, Corynebacterium diphtheriae. From this, we have to inoculate into potassium tellate blood agar and kept for further incubation 48 hours. And then antibiotic sensitivity, finally, for culture. These all you will see and read in systemic bacteriology. Culture media, how to culture each organism, what biochemical tests they will perform. These all you have seen in systemic bacteriology and general bacteriology. Upper respiratory tract infections. For suspected viral upper respiratory tract infections, I already said this. Again, I am telling, showing flowchart. Upper respiratory tract infections. For suspected viral upper respiratory tract infections, nasopharyngeal swabs, aspirates, and throat swabs. And blood, serum will be done. This serum, Paul Bunel test, infectious mononucleus, anti-EBVG, immunoglobulin M will be identified. For this viruses, cell cultures, adenovirus, Epstein-Barr virus, human virus, influenza virus. For suspected fungal upper respiratory tract infections, culture throat swab onto SDA, and organism is Candida albicans. Now come to lower respiratory tract infections, mainly Lower respiratory tract infections, it causes trachea, will be seen as trachea, pneumonia, and lung abscess will be seen. In pneumonia, I told already, hospital acquired pneumonia, and another one, which one? I told already in first one, community acquired pneumonia. CURB, less than 1 point, it can be, the patient can be immediately joined in hospitalized. More than 1 point, the patient can be treated at home. No need to hospitalize. Pneumonia. Acute, community acquired nosocomial infections. అంటే nosocomial infections are nothing but hospital acquired infections. Nosocomial infections are nothing but hospital acquired infections. Community acquired infection. Subacute or chronic tuberculosis, fungal, aspiration pneumonia, and lung abscess will be same. Pneumonia in immunocompromised patients will be usually same. Clinical presentation. Acute community acquired infections are cough, usually seen, fever, and chest pain will be observed in these patients. Acute healthcare associated patients will be ventilator associated pneumonia. Chronic pneumonia. In chronic pneumonia, the patient will cough, fever, and night sweats, and weight loss will be usually seen in chronic pneumonia. Lung abscess. In lung abscess, chest pain will usually commonly seen, and cough and fever will be seen. Specimens, collection and transport. Sputum. Specimen is best sputum. Induced sputum, endotracheal aspirate, and bronchoalveolar lavage. These specimens can be collected in lower respiratory tract infection patients. In the upper respiratory tract infections, causative agents of laryngitis, pharynx and laryngitis, or laryngotracheobronchitis. In this, inspiratory statra, hoarseness, fever, cough, usually seen in these type of patients' clinical symptoms. In epiglottic region, edema will be usually commonly seen, and inflammation of epiglottitis and soft tissue above vocal cords spine. ఇవి కామన్ గా చూస్తాం. swollen అవడం, epiglottis inflammation, edema usually seen in soft tissues. దానికి కాజ్ చేయడానికి కారణమైన ఏజెంట్స్ బ్యాక్టీరియా అయితే మైకోప్లాస్మా, న్యూమోనియా, హీమోఫిలస్ ఇన్ఫ్లుయెంజా టైప్ బి, అండ్ బార్డిటిల్లా పెక్టిసిస్ బ్యాక్టీరియా. అదే వైరస్ అయితే పారా ఇన్ఫ్లుయెంజా, రైనో వైరసెస్, కరోనా వైరస్, ఎడినో వైరస్, అండ్ రెస్పిరేటరీ సిన్షియర్ వైరస్. ఈ కరోనా వైరస్ వల్లనే కదా మీకు అన్ని సెలవులు, ఆన్లైన్ క్లాసెస్. SARS virus, it comes under SARS, coronavirus, severe acute respiratory. Laboratory diagnosis. For this, microscopical examination, Gram stain will be done, Gill-Nielsen stain, and Albert stain. Gram stain, rotated all microorganism bacteria can be done for Gram stain. Gill-Nielsen stain, especially for Mycobacterium tuberculosis. Albert stain, especially it is a special stain. These two are special stains. It have done for Corynebacterium diphtheria. Gram stain, Staphylococcus, Streptococcus, Pneumococcus for this. Culture, blood agar. If these Staphylococcus organisms, Staphylococcus, Streptococcus, Pneumococcus, these all will be grown on blood agar. Routine culture media. Blood agar, Macaulay agar, and potassium tellate blood agar culture can be grown organisms. It is a special media, especially unwanted bacteria will not be grown, and suspected organism can be grown on this special media, potassium tellate bed agar, diphtheria, Corynebacterium diphtheria. Sabrous dextrose agar, Candida albicans. All other fungal also can be grown on Sabrous dextrose agar, especially in this lower respiratory infection, Sabrous dextrose agar, Candida albicans. Candida is a species, Candida albicans. In that species, Candida albicans. Laboratory diagnosis, serology, serological tests, Mycoplasma pneumonia, Streptococcus, cold igniting test. These are titers less than 1:20, titer less than 1:32. Cold igniting. Chlamydia, microimmunofluorescence test or ELISA, enzyme linked immunosorbent assay. Procalcitonin, invasive pneumococcal disease. For this, lower respiratory tract infections, pneumonia, I told, hospital acquired and community acquired pneumonia. In pneumonia, the sample may be sputum, spontaneous or induced. Another one, these are lower respiratory tract infections now. If throat swab aspirate will not be there, then endotracheal aspirate or bronchoalveolar lavage, non-bronchoalveolar lavage, ventilator lavage. These are swabs. Another one, blood examination, serum. For sputum, microscopy. We have to run gram stain for bacteria and fungi. Fungi, especially Candida albicans. Bacteria, Streptococci, Staphylococci, Klebsiella pneumonia, pneumococci for these. Jaden stain, especially for Mycobacterium tuberculosis. For this sputum culture, it can be cultured into blood agar, chocolate agar, McConkey agar. Most bacteria will be grown in these three. LJ medium for Mycobacterium tuberculosis. It can be cultured for how many days? Mycobacterium tuberculosis. If you remember or forget. For these, 24 hours be sufficient. For this LJ medium, Lowenstein Janssen medium, 6 to 8 weeks. Mycorrhizals in chlamydia, Sabrous dextrose agar is a fungi growth, Legionella for culture. Finally, on third day, antibiotic sensitivity, antimicrobial sensitivity testing. For Streptococcus, especially for confirmation, antibiotic sensitivity testing test, we can for bacitracin. For pneumococcal antibiotic sensitivity testing, we will put optocin. These all antimicrobial sensitivity testing, the media used is Muller-Hinton agar media. It is so called, then we will use routinely nutrient agar media also. But the media specially used for antimicrobial sensitivity testing, Muller-Hinton agar media. For all organisms, we have put antimicrobial sensitivity testing plate, all routine for gram positive organisms, gram positive discs, gram negative organisms, gram negative discs, and these are antimicrobial discs. And urinary tract infections, especially urinary tract infection, antibiotic discs will be available in market. Those we have to put antimicrobial sensitivity testing. For especially for Streptococcus and pneumococci, these two can't done antibiotic sensitivity testing on Muller-Hinton agar media. These two can be performed on blood agar media for this antimicrobial sensitivity. In center, we have to put for bacitracin. If it is Streptococcus pyogenes organism, then it will show a resistance pattern or sensitive pattern on that bacitracin drug. It can be placed in blood agar media. The same like that only for pneumococci also we have to put optocin in blood agar media in center. The zone of inhibition will be there, then we are able to see it is sensitive or not. For all other organisms, antimicrobial sensitivity testing can be done on Muller-Hinton agar. For pneumonia, for endotracheal aspirate or other lavages, cell cultures, mainly influenza virus, para-influenza virus, cytomegalovirus, and respiratory syncytial virus. Pneumocystis jirovecii, CP, IF ante immunofluorescence. Neutralization tests can be performed. For serum for mycoplasma antibodies, chlamydia for mycoplasma antibodies detection test, and chlamydia antigens and antibodies, antiviral antibodies can be same. For serum for procalcitonin, this one, like this bits are very important. Sputum specimen sent for culture is considered good quality if it contains, ఇప్పుడు మనం స్ఫోటం శాంపిల్ ఇచ్చాం, వీటిలో ఏది అది ఉండాలి, స్ఫోటం స్పెసిమెన్ సెంట్ ఫర్ కల్చర్, మనమే ఒక కల్చర్కి స్ఫోటం శాంపిల్ ఇచ్చాం, ఇట్స్ కన్సిడర్ గుడ్ క్వాలిటీ ఇఫ్ ఇట్ కంటైన్స్. ఏవి ఇందులో ఏముంటాయి, పస్ సెల్స్ మోర్ దాన్ 5 లో పవర్ ఫీల్డ్ అండ్ ఎపిథీలియల్ సెల్స్ లెస్ దాన్ 25 పవర్ ఫీల్డ్ ఉంటే అది మంచిదా. పస్ సెల్స్ లెస్ దాన్ 25 లో పవర్ ఫీల్డ్, ఈ లో పవర్ ఫీల్డ్ అంటే 10x. I have to observe in low power field. And epithelial cells more than 5 low power field. Pus cells less than 25 and epithelial cells less than 25. Pus cells more than 5 and epithelial cells more than 5 low power field. అప్పుడు ఏది గుడ్ శాంపిల్, మన స్ఫోటం కలిగి ఉంటే పస్ సెల్స్ లెస్ దాన్ 25 లో పవర్ ఫీల్డ్ ఉండాలి, ఎపిథీలియల్ సెల్స్ మోర్ దాన్ 5. ఇది సెకండ్ వన్. పస్ సెల్స్ లెస్ దాన్ 25 ఉండాలి. పస్ సెల్స్ ఆర్ నథింగ్, ఆల్ పస్ సెల్స్ ఆర్ వాట్ ఆర్ పస్ సెల్స్ అంటే నథింగ్ బట్ న్యూట్రోఫిల్స్, డెడ్ న్యూట్రోఫిల్స్ ఆర్ పస్ సెల్స్. న్యూట్రోఫిల్స్ ఎలా ఉంటాయి, 5 లో ఉంటాయి. పస్ సెల్స్ కూడా ఎప్పుడైనా చూసారా, అలాగే ఉంటాయి 3 or 5 లో. సెకండ్ వన్, పస్ సెల్స్ లెస్ దాన్ 25 ఫర్ లో పవర్ ఫీల్డ్ ఉండాలి, ఎపిథీలియల్ సెల్స్ మోర్ దాన్ 5. నౌ ఫైనల్లీ this examination of blood serum useful in following ways. అదే ఇన్ ఎగ్రాన్యులోసైటోసిస్ లో అనుకో, పాలిమార్ఫ్స్ ఆర్ సిగ్నిఫికెంట్లీ reduced in number. Granulocytes, polymorphs are significantly reduced in number. అదే leukemia అనుకో, in acute leukemia cases WBC count is greatly increased and varying number blast cells in blast cells may be seen in that blood film. Smears can be made in their blood film. Blast cells may be seen in the blood film. Acute leukemia, WBC count is greatly increased. Ade in infectious mononucleosis, there is significant increase in number mononuclear cells. In circulation, mononuclear cells significantly increase number will be seen in infectious mononuclear cases. For microscopy, GMS అంటే గోమోరి మిథేన్ సిల్వర్ స్టెయిన్, ఇట్స్ ఎ జిమ్సా స్టెయిన్. For especially pneumocystis jirovecii, it can be seen in parasite and it can be covered in fungal also. Pneumocystis jirovecii, Gomori methenamine silver stain, right. Gomori, G for Gomori methenamine silver stain, it's a Gimsa stain for pneumocystis jirovecii. With this Respiratory infections over. Syllabus slowly it is going on passing away. But you read or not, we don't know. With this, respiratory tract infections completed. Next class we will see. Okay. Bye. How are you all? Reading well or not? This second year is passing in holidays and you are be at home and listening classes, not coming regularly for college. There is no clinical postings, everything. You are enjoying. Okay. Take care. Bye. Bye. Okay.